Good afternoon. I thank the association for the privilege to present our data on behalf of my co-authors. Our presentation is named A Single Sequential Saphenous Vein Graft versus Separate Left and Right Vein Grafts in Coronary Artery Bypass Surgery. These are my disclosures. None of them relates to this presentation. So, ladies and gentlemen, left internal mammary artery to LAD and vein grafts remain the most used strategy for surgical revascularizations. You may use sequential vein grafts, and those who advocate the use of this argues that you get an increased blood flow and a lower risk of graft occlusion with sequential vein grafts. Others argue that these are technically more demanding and there will be a large myocardium risk in the event of a proximal occlusion. A special form of the sequential vein grafts is the snake graft that crosses over from the right coronary territory to the left coronary territory, as opposed to separate vein grafts to the left and the right territory. So the objective of our study was to compare early and midterm outcome after snake grafting versus separate vein grafts in a large contemporary study cohort. So this is a retrospective observational population-based cohort study. We used data from the Swedish Heart Registry, the SwedeHeart, which contains information about all cardiac surgery operations since 1992. And we used also the Swedish National Patient Registry, which all hospitalizations in Sweden are registered. Our main outcome variable was a composite of death, myocardial infarction, reangiography, and new revascularization. And we also will report those variables individually. The mean follow-up was 35 months, and this was complete follow-up in 99.8% of the patients. We only missed foreign patients that were operated while visiting Sweden. Our main statistical method was logistic regression for 30-day outcome and Cox regression for mid-term outcome. We adjusted for age, gender, Euroscore 2, number of peripheral anastomosis, year of surgery, previous MI, diabetes, hypertension, previous stroke, and atrial fibrillations. And we did also sensitive analysis, including propensity score matching and also Cox regression on propensity score matched cohorts. So we started with all isolated first-time CABG in Sweden between 2009 and 2015. We excluded those with unknown graft configuration and those with no lima to LED, no other arterial grafts, and only one coronary artery area grafted. So we ended up with 6,909 patients. 2,229 of them were operated with a snake graft and 4,780 with separate grafts. And these are the two study populations, the snake graft, and as you can see, there are no major differences between those two. And when it was some kind of difference between them, those were adjusted for in the statistical analysis. And now to the results. These are the 30-day results in the snake group and the separate graft group. And as you can see, the composite endpoint occurred in 5.4% of the patients in the snake graft group and 3.9% in the separate groups. And after adjustment for all these factors that I mentioned before, there was an odds ratio of 1.31. That is a higher incidence of the composite endpoints in the snake graft group. Death did not differ significantly, although there was a strong trend towards different results between the two groups. Myocardial infarction and revascularization did not differ, but there was a significant difference in the incidence of reangiography at 30 days with an odds ratio of 1.51. So these are the mid-term results. Again, in the snake graft group and the separate groups, and as you can see, there's no longer any significant difference between the two groups, with 17.7% in the snake graft group, 17.6% in this group, in the separate vein groups. The only factor that remained statistically significant between the two groups was reangiography, which was an hazard ratio of 1.25 in the snake graft group. This slide shows graphically the results that I just showed you. On the x-axis is the time since operation, and the cumulative incidence for the composite endpoints on the y-axis. The shaded areas are the 95% confidence interval. And as you can see, there was a difference in the beginning here, but this, at the end of follow-up, there was no significant difference between the two groups. As indicated by the results at 30 days and at midterm follow-up, there was an interaction with time. And this is illustrated in these two slides. Again, the shaded area represent the 95% confidence intervals. And you can see that both for composite endpoint and for death, the hazard ratio was much higher in the beginning, approaching 2.0 in both groups. And then for the composite endpoints, it trended towards the hazard ratio of 1.0, while in the death group, it trended to be lower at the end of follow-up time. This is the results of one of the sensitivity analysis. This is propensity score data and an adjusted Croc's proportional hazard model. And you can see that the results are almost identical to the ones achieved with our primary method. So, ladies and gentlemen, our conclusions. Snake graft had a significantly higher rate of early complications, possibly reflecting a more demanding surgical technique. The midterm results, with the exception of re-angiography, did not differ significantly between the snake grafts and the separate grafts. Both snake grafts and separate grafts are valid options. Based on these investigations, one strategy cannot be recommended over the other. Thank you for your attention.